These are the real stories of the patients, medical, and support teams of St. Joseph Mercy Health System, whose lives intersect for a brief moment in time to achieve remarkable outcomes.
We bring hope, we bring love, we bring our strength, and all we're made of, you and I, together.
As you tuck yourself into bed tonight, let me ask you, do you snore? Does your spouse? I'm Lila Lazarus. For some 18 million Americans, it's more than just snoring. They're actually gasping and waking up over and over again, dozens of times a night. It's exhausting. It's called sleep apnea. It's more than just snoring. Sleep apnea can be deadly. For some people, this is an option. It's the Cpap machine. It blows constant air, keeping your airways open, helping you breathe easier, sleep better. It works. But there are people who can't tolerate the machine. It's not for everyone. Now there's an answer. In the form of a robot. A brand new surgery that isn't just giving people a good night's sleep. It's saving lives.
My mom and dad have been married for 50 years.
We've been married for 48 years.
Almost 50 years.
Same guy.
Same guy. Same wonderful guy.
Always together, do everything together. Their hobbies pretty much each other.
It's a nightmare coming to bed because, I mean, I know what's going to happen to me and I know what's going to happen to him. It's like...
Yeah, don't sleep.
She was snoring.
When you hear that snoring, can you believe that's you?
Doesn't sound like a person. It seems like something in the barn. Sometimes I wake myself up with the noise.
She's just been tired and she snores all the time, and my dad's constantly, he's getting scared now. He says she stops breathing at night.
I'm worried about she don't wake up because sometimes look like she choke.
He was worried and scared for me because I stopped breathing.
I'll be really, really scared.
I was just worried about her not waking up in the morning.
I thought she would die.
Snoring is very common. It's actually a sign of a more serious problem, which is called obstructive sleep apnea, which occurs in many people who snore.
You would do anything possible to help her out, anything, because she's like the glue to our family. She holds it together. She really does. I'm not just saying, she really does.
You're scared because, you know, at first you don't even know what's happening. You think something is growing in your throat or something is happening there.
Every 10 minutes, I have to get up and go check for my wife because she fall asleep over there on the sofa. I know.
It's got to shake me and shake me. You wake up, it's like catching your breath when you come from underwater, you know.
That's scary. Very scary because even I want to sleep, I can't sleep because I'm worried.
He is a very attentive husband, and he's so worried about his wife. I think we're treating him more than we are treating his wife.
It's become pretty scary. You hear a lot of bad stories about sleep apnea.
Sleep apnea has been linked to a lot of problems, particularly with heart disease, high blood pressure, depression. The main thing the patient experiences is fatigue.
I'm tired, I'm tired, I'm tired.
They can't concentrate, they have headaches.
They can't concentrate too good and keep on forget things.
Then if you start to measure important things like their blood pressure, you'll see that the blood pressure is coming up.
Everybody told me I was snoring. I'd fall asleep in the living room, I'd fall asleep at her parents, and you know, they'd wake me up laughing at me because I was snoring so loud.
Sounded like the train that you hear a lot go through.
I wasn't playing hockey, I wasn't swimming, I wasn't doing any of the things that I enjoyed doing.
You're not exercising as much, so you start to gain a little bit of weight, and all of a sudden there's extra tissue in the back of the throat that starts to make the snoring worse, and next thing you know, you start to have obstructive events.
Headaches because of the high blood pressure, yawning all the time because I was tired, because I wasn't getting sleep.
Snoring's nothing. It's the stopping the breathing. So I can deal with as much snoring as I need to deal with, but when you're laying in bed, listening to the person you love stop breathing, that's scary.
I went probably 10 years without a good night's sleep.
None of us were getting any rest. Even our son would report, because his room is so close, that it would wake him up at night.
And I was in bed for 8 hours a night, but I was stopping breathing 45 times an hour.
You know, when you hear someone stop breathing and then you count. Okay, how long is this going to take before he breathes again?
That's what brings a lot of patients in, is their spouse is concerned when they see their bed partner stop breathing.
I got almost 20 seconds before he started breathing again.
But I've seen people who've had stopped breathing for over a minute at a time, many times per hour.
I want him to be there when our kids grow up and graduate high school and get married and have families. You know, I don't want to do this alone. You have to lay there in bed night after night and listen to him stop breathing and wonder, you know, what it's doing to his health and you know, and how do you explain that to your kids if you wake up one morning and he's dead, you know. That's the scariest thing ever.
And I wasn't dreaming, so, you know, I mean, that was another indicator that the sleep cycles weren't happening.
You don't dream, you fall asleep for a minute at a time and then you wake up a little bit, but you never get into that deep stage of sleep.
Why couldn't you wear the mask?
It's uncomfortable. I don't think it's humane. It's just, it's uncomfortable.
Patients that come to me typically have failed Cpap, which is the device that people are given for sleep apnea.
I was very upset when she didn't keep using the mask. I know that helps if you can do it.
Sometimes just people are claustrophobic, they just can't stand having something on their face, or they wake up in the middle of the night and the CPAP machine's at the side of the bed. So you're not really helping people if that's the case.
This is what you wear. It goes over your head, and you sleep with this. And this pumps air, so it'd be like, you know, just air compressor blowing air into your mouth to hold your throat open. In 5 years, I made it two full nights.
CPAP is tolerated by many people, but for those that don't like it for whatever reason, they have to have alternatives. You can't just not treat your sleep apnea without having significant risks.
One of the reasons I also considered surgery was because I didn't want to live with this contraption the rest of my life. So it was definitely something that I wanted to get rid of.
He wanted a cure. I mean, he's young, he's otherwise healthy, you know, he's got a young family. He doesn't want to be tethered to something. He wants to just be normal again.
You're kind of cute like that.
Oh, yeah. There are people who swear by it. I've got a friend who was scared to death when he went on a recent trip that he wasn't going to have power access to his machine because it's his lifeline. It just didn't work for me.
I was watching the news one day and we saw a little segment with Dr. Hoff in it.
Dr. Paul Hoff is a robotic surgeon with St. Joseph Mercy Health System. What exactly is sleep apnea?
Sleep apnea is caused by an obstruction of the airway.
And you can cure that with a robot.
The Da Vinci robot is a unique tool that allows me to access areas of the throat that I really wasn't able to access before, particularly the base of the tongue.
So he calls me, he says, Mom, maybe there is an answer. Why don't you go see him?
I just thought whatever it was, it could help. It seemed cutting edge. It was great news.
Robotic surgery is an awesome tool to access areas of the body that we haven't been able to get at before in a very reasonable way.
The snoring, that's not good for her. Not good for nobody, you know. But I hope this is going to be resolve the problem.
So this surgery is as much for him as it is for you.
It's more for him. It's more for him. I don't want to die, but I don't want to be divorced either. I'm scared, and if I go through this, through the pain, and it's not going to work, it's not going to be fun.
What's your biggest dream after this surgery?
Oh, I got to go to Italy, the first thing I'm going to do. Oh. God.
How long's it been since you were in Italy?
3 years. I couldn't go alone because of this.
And if it looks like they're a good candidate, particularly if they have a lot of tissue at the base of the tongue called the lingual tonsil or tongue tonsil, that's my target. And if that is large, then I can tell them confidently that I can help them with their sleep apnea.
Dr. Hoff thought that I was a good candidate. He looked at all of my records and thought that I was a good candidate for surgery.
It's just an anatomic obstruction, and you know, it's fortunate we were able to discover that and actually have a tool to get at it now. So.
My mom, she's my best friend. She holds everybody together. Okay. Stop. Oh my God.
We're all a very close family.
You're lucky.
very, very lucky.
Okay, ready to go. Are you ready?
I'm getting there.
Huh?
I'm getting there.
It'll be fine.
You think so?
Yeah.
You better hope this works because it's your birthday present. If
That's
if it doesn't work, you're out of luck. No presents for you.
I'm gonna be.
It's gonna be fine.
Perfect.
Yes. Happy
and be-
birthday.
Thank you. And it's gonna be good. Okay?
I will. I will.
See you, Ma. Good luck. You can be good. Love you too.
Love you.
Love you. Be good.
Take some nice, big, slow, deep breaths from me, Anna. Okay. She's doing great. Doing wonderful.
You ready to go for a ride?
Yeah, I'm ready to go for a ride.
We just live a few miles from downtown. If we don't walk downtown, we take the scooter downtown, and if we go out to dinner, it's really fun. We feel like it's a little taste of Paris.
Say behind every great man's a great woman, I guess, but I run the family, you know, take care of the kids and try to keep things going around the house.
My wife is a wonderful person.
So she's here for a screening. Okay, so you're just going to do the 4 views. Is that what you've got here?
She's from Warren. She's the youngest of 8 kids.
Was it love at first sight?
I saw this young man at the med school picnic. You know, he's really cute. He's got those big blue eyes. And I thought, you know what? I said, this could be the man I marry.
My father was a neurosurgeon, and I really got the bug. I really wanted to go to medical school. I got into Michigan. I met my wife. First week of medical school. Her last name was Hyde, mine was Hoff. We sat next to each other, and that's where it all started.
He was a nice dresser. He wore these nice polo shirts. Only found out later on that his mom was dressing him, but that's okay. It was still very cute.
You guys ride a tandem.
Ready? 1, 2, 3.5.
Where are we going to go today? You always like going on destinations.
I know, we have to go someplace where I can get a coffee or something like that. Can you even feel me pedaling back here?
I'm waiting for you to start pedaling. This isn't a rickshaw.
That's like couples therapy.
Couples therapy, yeah, it can be couples therapy. You have to get along to ride on a tandem.
Okay, you ready?
Yeah.
Gonna take a little muscle.
Big hill.
Okay. I've been married to Paul for, gosh, that's a flub right there, since 1993. So,
Are you sure?
Yeah, we've been married for many, many years, and we've got 2 children.
Do you know how long they've been married?
I'm 16, so I don't know, longer than that.
Like 17, 18 years. I don't know.
Don't feel bad, your mom didn't know either.
I have 2 daughters, and my oldest daughter's 16, my youngest is 13. They're active in sports and dance and music. Ann Arbor's a great place to bring up kids.
Is he a good dad?
He's a very good dad. Yeah, if you ask the kids, they'd probably say he's a little too strict.
He does love country music. He listens to it like non-stop, and 70s music. He plays it in the car. It's really quite interesting.
What's it like, 2 doctors married to each other?
Well, it's kind of interesting. We keep pretty busy. It's been a lot nicer since I started working here 4 years ago, because we get to actually see each other sometimes in the hallway. Lauren, I think, is getting ready for her big swim tomorrow.
I can't believe that she's going to be doing a 6K swim. You
It's
know?
a 10K.
I mean, it's a 10K swim,
Yeah.
6-mile swim.
Good luck, Lauren.
He's a good husband. Yeah, he probably works a little too much.
What are we going to be doing tonight? Any plans? You working late?
I don't know. It looks like it might be raining out, but I was hoping to maybe go out to the lake or something. Oh, my girls are so different. You can't even imagine.
They're great together. I mean, I've never seen them fight. They seem like they're in love. I mean,
And they can talk doctor stuff to each other and leave us out of the conversation because we don't understand what they're saying at all.
Cool thing is with the robot, actually it has.
You'll be able to start drinking coffee again?
Yeah, because it has
controls any kind of jitter you might have.
Robotic surgery is very team-oriented because it's a complex piece of machinery for one thing, and people have to know how to set that up.
It sparked something new for him. You know, he's really, sort of jumped back into his career again.
When I get in there, the robot's all ready to go, the instruments are all set up, and my bedside assistant is there ready to go.
Paul has always had it in him to do more than just be, an average doctor. He always wanted to do something that was, exceptional.
He cannot walk with his cell phone. When he's on his phone talking to someone, he just stands there. It's really funny. He can do robotic surgery, but he cannot talk on his cell phone and walk at the same time.
I like to ride my bike to work.
I go 10 miles, I'm going to pass out. He goes like 60, and he's okay with that.
Finding time to work and bike and be as good as he is, that's amazing.
He's a good guy. I'll keep him. I'd fight for him.
I really appreciate St. Joe's. It's not just a large, really good community hospital, but it's part of a greater health system. You feel like you have the support of super specialists at St. Joe's.
Here we are waiting and hoping it all turns out great and don't have to worry about it anymore.
She's a good mom. She's a great nana. She needs to be around, so we're keeping her.
You ready?
I'm ready. All right, thanks. So this little stuff, you have to get up as high as you can here.
Let me just check here.
Can we go that way? So that's set up. Got that. We got these off. So once we get the patient set up, get the intubation done, and then we get the bed rotated, get the robot docked, then we put the mouth retractor in there, and all that takes about 20 minutes, and now we're ready to go, pretty much. Now we have this nice high-definition camera that we're going to be looking at. I have even better view here, though. This is 3D. Some of the doctors they take their shoes off. It's just more comfortable. A lot of people wear little slippers.
Traditional surgery can address big tonsils or a long palate, but the transoral robotic surgery allows us to get to the back of the tongue where obstruction is occurring. We always look for a certain amount of tissue to remove, and once we get to that point, we know that we've done a good job and we're very confident that we've helped the patient. This is all just done through the mouth. Patients don't have any incisions, no disfiguring scars, which would have been required in the past. They're very happy. The actual surgeon is sitting at a console in the operating room controlling the robot.
How does that feel for you to be 20 feet away from the patient?
You feel like you're right there. It's a high-definition camera. It's three-dimensional, so you get an unbelievable view.
I never really thought about the robot other than how cool it was.
It is sort of like playing a video game. You're looking at a console and you're controlling the movements of the robot with little instruments at your fingertips. It's neat technology, but you don't feel like you're disconnected from the patient.
How about the fact that the doctor is 20 feet away?
I just had so much confidence and trust in Dr. Hoff, and knowing that he was at the controls, it didn't really, I guess because maybe I'd never seen it, it didn't really bother me.
We did something called a lingual tonsillectomy, which is where you use the robot to remove the tissue at the base of the tongue. We got a certain volume of tissue out.
How's it going?
Good. We got the amount of tissue out that I wanted to, and I'm just trimming the epiglottis.
The robot makes it easy to do the surgery. That's the key. We've never had an easy way to get to the back of the tongue. Before we had the robot, the outcomes were a lot less predictable. Now that we have the robot, we have a much more predictable outcome.
From here, she'll go into recovery for a short period of time in ICU just for close monitoring. We want to make sure her airway is good. The breathing tube will come out in the OR and hopefully go home tomorrow.
That's great.
Yeah. Went well. Yeah, we got it done. We got everything done that we wanted to. She's going to have a great result. And I told her husband that he may anticipate even hearing the breathing much more relaxed tonight. I'm going to go talk to her husband and her son who are here, and then we're going to hopefully celebrate.
The husband's going to celebrate.
Maybe earlier. Hey, yeah, everything went great. It went just as we expected. Got everything done we talked about. I remember I was telling you about the amount of tissue we wanted to get out. We got exactly that amount, about 7 milliliters of tissue that was right at the back of the tongue.
Thank you, Doctor.
All right.
Thank you very much. Appreciate it. Thank you.
When I see you come outside with the camera, I say, that's good. That's good news. Soon I see him.
It's my dad's birthday. It's his birthday too, so he gets a birthday present.
Yes?
Hello.
Hi, doctor.
How are you? Have you noticed any differences in your sleep or
Yes,
breathing?
much more comfortable.
Oh, good.
She hasn't been talking so much this week. I can't say that that wasn't a nice little break. I told her she's Italian and all that. It was a little, just a little. But now she can start again. It's good.
I'm not gasping at all. I sleep with my mouth closed.
I'm encouraged that your breathing is much better at night, and you're just going through the usual discomfort right now. She's a week out, and she's breathing better already. That's that's the best you can hope for. It's really exciting. I mean, that's kind of why you go into medicine, to help people get better.
Banana doesn't going to snore anymore now. I'm not going to snore anymore, and I'm not going to scare you or Mark or Natasha. Okay, Nana's going to be all right now.
See you in 2 or 3 months then, okay?
Thank you,
okay,
doctor,
all right,
so
good to
much.
see you.
Thanks.
Okay, see you.
Within a couple of days, she was feeling much more rested. Her husband was happy. She was no longer obstructing, and that's short term.
Okay, show me your scars.
I don't have any scars. Everything was done without any incisions, so the recovery was all internal.
There were no bandages, there was no nothing.
It was odd because I didn't realize that I wasn't dreaming. Probably my 3rd week of recovery, I started dreaming, and that was my sign, like, wow, okay, this must have done something right.
They suddenly realized that, wow, I haven't dreamed in years, and now they're dreaming again. And it's just a little pleasure in life to dream, and they get that back.
It's crazy what your mind can come up with in the middle of the night. So it's kind of cool. That's my sign to me that I know I'm feeling better.
His breathing is so quiet. Like, sometimes if I'm awake, if I happen to be awake, I'm like, is he breathing? Because I can't tell. But generally when he does snore, it's so quiet now.
All right, you guys ready? Let's go.
I feel so much better.
He gets right up out of bed in the morning. He's a lot happier during the day. I'm really happy for him and happy for us as a family.
Here we go.
You look amazing.
Well, thank you. Thank you.
You're sleeping.
I'm sleeping, that's why.
This is a whole new you. You look rested, you look beautiful, and you look energized.
It's a big difference.
What would you say to somebody suffering with sleep apnea who's thinking about this operation?
I wish I would have done it 2 years ago. It does work. It worked for me. Why shouldn't it work for anybody else? Here, Francesca. You think I forgot? Orencina.
She's back. The load is off. Not worrying if she's going to wake up in the morning. So it's fantastic. Just excellent.
I sleep good. I mean, I could sleep 10 hours just fine. And
10 hours?
10 hours, yes. And I'll wake up, then I'm relaxed, and of course it makes the difference.
Anna's going to be able to go back to Italy now. She's not going to have to take the Cpap machine with her. She'll be able to stay in her family's house and not snore and keep everybody awake. So it'll impact on her life in a big positive way.
My husband, that he can sleep and he doesn't have to worry about me gasping.
Nana, look at all the peppers.
Yeah, but now when you pick the peppers, you don't do it just, you don't pull. You gotta hold the plant, no, you hold the plant and you do it this way. The grandchildren, I still yell at them, but it's okay. It's a different story. I can tend to my flowers and do everything that I want to. It's another hump in the road that I went over it, I did it, it's good, and now life goes on, much better than it was. And so it's great. It's a whole world of difference. I am very lucky.
Buon appetito.
Buon appetito. Grazie. They have a beautiful family. That's my main thing anyway. That's all I want. It's a beautiful family and being able to sleep at night. That's it. It's great. I'm lucky.
Everybody's happy because they're sleeping. As you tuck yourself into bed tonight, think of snoring as a cry for help. If you or someone you love has sleep apnea, take it seriously. For more information on a sleep study, the Cpap machine, or robotic surgery, call 1-855-SJ-ROBOT. That's Discover Remarkable at the Heart of Medicine. I'm Lila Lazarus. Sleep tight.
So you had a good day?
I did, yeah.
Good.
For the record, we've been married for 19 years, 9 months, and 3 days.